Good morning. We are continuing the lesson today. Again, the physiology and sports. And the topic we are discussing, that is sports injury, in which we have discussed abrasion. These all are the injuries are the categorized in soft tissue injuries, abrasion, contusion, laceration, incision, and two muscle injuries are there, sprain and strain. These all are in the soft tissue injuries, the category of soft tissue injuries. So, in this order, first we have discussed abrasion in previous video. So, we are continuing with the contusion today, second injury of the skin injury, because the skin injury and the muscle injury are all the soft tissue injuries. So, first skin injury we have discussed, that is abrasion. So, today we are discussing the contusion, that is the soft tissue injury and skin injury. So, contusion is also called bruisage. This injury is caused by a violent hit. Consider, just focus to the word violent hit by an object or round or smooth surface. Means the object which is hitting the body part should be with round surface or smooth surface. If any object is hitting the body or body part or skin with a round surface and smooth surface. Round surface we can understand that it's like the cylindrical object. Smooth surface where the surface is smooth. So these type of surfaces are when hitting the skin, when hitting the body, then they cause contusion. There is the injury in which continuity of external layer of skin remains unbroken. External skin means outer skin will remain same. From the outer layer of skin there is no any wound, nothing is there. So that's why in this injury the continuity of external layer of skin remains unbroken, but internal bleeding occurs in the skin. Internally there is the bleeding inside the layer of the skin, because there are three layers of the skin: epidermis, mesodermis and endodermis. Outer layer, middle layer and internal layer. So that's why this injury is not affecting the external layer. External layer remain unbroken, but internal layer there is damage and bleeding is there. Contusion are not very deep. Contusion is not very deep. That we will discuss some of the injuries further. We will discuss they are very deep, but contusion is not very deep under the skin, so that the bleeding cause a visible discoloration like blue or black spot under the skin. So in this case, in case of contusion, we see then there are the discoloration over the affected area of the skin, and the person, we can see the visible effect, we can see that there is discoloration. The color of the affected area change black to bluish. The bruises then remains visible until the blood is either absorbed by the tissues or cleared by the immune system action. So that spot, the black or bluish spot over the skin, which is visible, which we can see, actually, which is under the external layer of the skin, that is visible, and which will be removed automatically by the system also, but it will take time. But this is the contusion in which we can see this spot, and this can be removed by the therapy quickly, no doubt. So immune system also works here to remove this, because that is the blood which is internal bleeding is there, which internal bleeding makes a clot over there, and that clot is visible blue or uh, black color, and this clot must be removed from there. So automatically also it is removed by the immune system action, but we must take therapy for quick removal of this clot. It is painful also. It is highly painful. No doubt the contusion is highly painful, like other sports injuries. So commonly we have seen the contusion whenever there is nothing is damaged, nothing injury we can see from outside of the skin, but internally there is a lot of pain and damage, and slightly we can see, then gradually the discoloration of the skin appears there. So this is the contusion, like in picture we can see the contusion is here. After the injury, there is the black spot is there over the skin. First picture, second picture, third picture we can see. External layer is not broken. The external layer remains unbroken, but after that there is the injury is there. That's why there is the discoloration of the skin. So contusion is very common, especially in sports, and especially we can say normal routine life. Contusion is very common, and commonly we see the contusion, but the cause behind the contusion is that is the hit by the object with smooth or round surface. What type of object is hitting the skin? The object with smooth and round surface. The object must have smooth and round surface, not sharp, because sharp object will make a wound. This is the object which is hitting the skin is with round or smooth surface. That's why this is called external layer remains same, but internally there is the damage of the skin, damage of the tissues. That's why it is soft tissue injuries. Management of the injury contusion. Wash the affected area with clean water and antibacterial liquid or antiseptic liquid. If there is, we do not have antiseptic liquid, antibacterial liquid, so we can wash it with clean water properly. Apply the topical analgesic to reduce pain and inflammation. Topical analgesic are known as the ointments which are used to relieve the pain only, because these are the ointments are made with the combination of capsaicin. Capsaicin is a component of the spicy, that is pepper, a chili. Chili really caused the burning sensation when you are eating so much chili, so much pepper. So this is the component of the chili. So that's why this component create a burning sensation at the spot of the injury. So that burning sensation goes to the mind, but person forget about the pain. This is nothing the treatment. This is only to forget about the pain. That's why topical analgesics are used. Analgesic means which reduce the pain. So topical means which are from outside. This is these topical analgesic. This is what I am telling about you. These ointments are only used from outside. That's why these are known as topical analgesic. So apply the topical analgesic to reduce pain and inflammation. The example I can give you topical analgesic like Iodex, pain relief. Lot of brands are available in market. These brands are uh, composition is same, but the name is different. So most common is Move, Iodex, pain relief. So these are the topical analgesic which can be sprayed or applied from outside of the skin, and they will help to reduce the pain, nothing else. Price therapy would be given. Price we have discussed. P for protection, R for rest, I for ice, C for compression, E for elevation. Go to the doctor for further treatment, because that is the objective of the first aid therapy, that we are not trying to treat the injury ourselves. We are only giving the primary treatment, and rest of the therapy will be given by the doctor, because they are the expert. They are the expert of giving treatment for any kind of illness and any kind of injury. Don't be master of anything by knowing the small things. Massage therapy, after 2 or 3 weeks, massage therapy is helpful because it helps to reduce the spot, remove the spot, black spot through the blood. So massage therapy is helpful. We can see certain more pictures are there to understand the contusion. The contusion is highly painful, highly painful, because there is nothing damage from outside, but internally there is a lot of damage of the soft tissues, and it takes a time. It takes a lot of time to get recover. See, some more pictures are there. Contusion is very common. Maybe we have seen. So this is all about contusion. I think we understand the contusion, that is hit by any object with smooth or round surface, and which is not causing any damage over the external layer of the skin. It is the damage internally, where internal bleeding and internal damage of the tissues, and which is visible from outside, that is in the form of blue and black spot. We will come to the next injury, that is next sports injury, that is laceration. Laceration is the injury caused due to a violent hit by an sharp edge object, which leads a cut or open wound over the skin. So, cut over the skin or open wound over the skin. So, we can understand the skin is getting damaged from outside, from just from the outer layer of the skin. As I have discussed in previous slide, that is the three layers of the skin: epidermis, outer layer; mesodermis, that is the middle layer; and the endodermis, that is the internal layer. So external layer is getting damaged. So that's why the continuity of the skin is broken externally and internally in this injury, which caused bleeding. The continuity of the skin is broken externally and internally. Sometimes if the injury is major, it may be it may cause the injury of the middle layer of the skin, mesoderm, as well as the endoderm, also internal layer. Depends upon the severity of the skin, the injury. So the continuity of the skin broken externally and internally in this injury, which caused bleeding, external bleeding, visible bleeding. We can see the bleeding outside. Laceration may be minor to severe and sometimes seriously dangerous. It depends upon the depth of the cut or wound and most the area affected. Laceration is very dangerous. Accordingly, the area and the depth, how much deep the cut is there, in which area the cut is there. Some of the very sensitive areas of the skin, if the laceration is there, so it is very serious injury, like at the site of the blood vessels, brain, even head. That's why head injury, open injury of head is always very serious injury. So laceration may be minor to major, minor to serious injury, according to the depth of the wound, depth of the cut, and area which is affected by the laceration, where the laceration takes place. So laceration always must be taken very seriously, because main thing is there, that is the blood loss is there. Either it is minor or major, the blood loss is there. So that's why the management of injury laceration is different. Put hand over, put hand or cotton immediately over the wound to stop bleeding. You must try to make efforts to stop bleeding, because blood loss can cause another problem in the body. So put hand if it is minor, or cotton if it is the major wound, immediately over the wound to stop the bleeding. So priority is the to stop the bleeding. We must stop the bleeding. There should be no excess loss of the blood, because blood is the transport, the medium of transportation in our body. Blood is the medium, we can say it is the basic component of the body to survive. So blood loss can cause any serious problem in the body. So that's why immediately after the injury, we are trying to put hand over the wound to stop bleeding. If it is minor, sometimes the wounds are major, we cannot put hand to stop the bleeding. So we can put some cotton or any clothing, anything like clothing, cotton, to press it and to immediately try to stop the bleeding. Slowly, slowly, the bleeding will stop. Second, price therapy should be given. P for protection, R for rest, I for ice, C for compression, E for elevation. Elevating the part, affected part above the level of the heart to reduce the blood flow towards the organ, towards the affected part. Then, when bleeding stops, wash the affected area with clean water or antibacterial liquid or antiseptic liquid, whatever is available. So washing is there, very important, because some dust particles, anything, whatever is stuck with the wound, that can create any infection further. So we can wash the affected area quickly. Apply antiseptic ointment with cotton and bandage to cover it, whatever is available. If antiseptic ointment is not available, so we can just cover it with cotton and bandage. Go to the doctor immediately for stitches if the cut is deep and large. We must go to the doctor because stitches are required when the cut is large and deep. So further therapy is very important. Take further treatment from the doctor till complete healing. So sometimes these lacerations cause various infections over the wound. So immediately we must refer the injured person to the doctor and take treatment for the complete healing. Then there is complete healing. We must take the treatment. We can see certain pictures of the laceration. This is cut. Just we were discussing. This is cut over the skin. It may be deep, it may be large, and it decides that which area this cut is there. So that's why this is very painful. Also painful, but also it can become a serious problem when it is in the sensitive areas of the body, like brain and at the site of the arteries. Next is incision. This is another sports injury. Incision is a cut over skin but deep into the skin. Just remember, because we have discussed laceration here. So this is just like a laceration, but the difference is this is the cut very deep. Incision is very deep. Incision is a cut over skin but deep into the skin. It is caused by any sharp edge object which penetrate into the skin by making deep wound. Incision injury, the wound are highly prone to infections. Incision is the injury, also incision therapy also, because sometimes we can remember that during now these days various surgical activities are conducted through incision, that is laser therapy, where doctors have to remove stone from the kidney. So there will be a small cut over the skin and they will remove that stone from the kidney. So incision is the same kind of injury in which any object, any sharp edge object is penetrating into the skin deep, and it is causing the injury incision. Incisions are not mostly wide. In case of serious injury, it may be wide also, but normally the incisions are not so much wide, but they are definitely so much deep into the skin. Incision injury, the wounds are highly prone to infections. It depends the depth of the injury. We can see the incision, the deep wounds are there. These deep wounds, if are not cured, not taken seriously, can cause infections. So incision is the injury in which any object is penetrating deep into the skin. Management of incision, we will see. Same as laceration, the incision is treated with more caution. Incision is treated just like the laceration, but with more caution, with more precautions, because it is highly prone to infection that we have discussed in previous slide. These wounds are deeper, hence dressing and cleaning of the wound is required on daily basis or as per the advice of the physician. These wounds are deeper, hence dressing and cleaning of the wound is requirement of the daily basis or according to the advice of the physician. Again we can see some more pictures are there of the incision. These are very deep. Sometimes stitches are required, but stitches are required along with daily dressing. Sometimes gauges are used. Gauges means the medicated bandage is put into the wound, which disinfect the wound from inside. Gauges therapy is also given sometime. Gauges are known as, that is the medicated bandage. Medicated thread is penetrated into the wound, which disinfect the wound from inside rather than stitching it from outside. So incisions are very painful and very and time taking treatment. Management of the incision therapy. How incision can be managed? Put hand or cotton immediately over the wound to stop bleeding. Definitely bleeding we have to stop. Price therapy should be given. P for protection, R for rest, I for ice, C for compression, E for elevation. Wash the affected area with clean water and antibacterial liquid, whatever is available. Go to the doctor immediately for stitches or dressing, whatever is the doctor will advise. Take further treatment from the doctor till complete healing. So these are the first aid, the therapies must be taken. Again we can see some of the pictures of the incision are there. Wound is deep, not so much wide. Accidentally, in serious cases, some of time the dimension of the object which is hitting the body, that depends upon the size of the object which is hitting the body. That cases the injury and the wound may be large, but mostly this is the not so much wide injury over the skin. So laceration is over here. We will come with the muscle injury in the next video. And laceration and the incisions are very common, but the difference of the depth and laceration, there is the cut by any sharp edge object, but incision, there is the any object, sharp edge object is penetrating into the skin, that is very important, penetrating into the skin, so which is causing the inside deep to the skin, the injury of the depth of the skin. So we will discuss further about these next injuries in next video.